Hello there, welcome to this Carbon Academy tutorial on A-level biology. In this video, we will look at the human respiratory system, where we'll cover the common lung pathologies at A-level and how to measure lung function. So let's look at the aims. We're only going to go through the ones in red, the others are covered in my previous video. So we'll go look at how breathing rate is controlled, explain how lung function can be measured, and we'll look at how asthma, COPD and fibrosis affects lung function. So let's get started. Have you wondered how your body controls when to breathe? There must be a system which says breathe in and out, in and out. Though not exactly like a yoga teacher, our breathing is controlled autonomically and as well voluntarily. Autonomic control of breathing refers to breathing that we don't think about. It happens automatically. But how does this occur? Well, CO2 made during respiration dissolves in blood to form carbonic acid. You may know from chemistry that acids release hydrogen ions, and these are detected by chemoreceptors in the body. Additionally, lactic acid is also another source of hydrogen ions, and the acid is made during anaerobic respiration. These chemoreceptors signal respiratory centers in the brainstem, highlighted in red in the diagram, which causes the diaphragm and the intercostal muscles to contract and ultimately increase the rate and depth of breathing. Do you ever wonder how anxiety or being scared makes you breathe fast? The worry you may get a U in your biology A-level may send chills down your spine, but you needn't worry because you're watching this awesome video. Anyways, enough of my waffle. Your emotions are controlled by your limbic system, which is also known as the behavioral and the emotion center. This can interfere and override your normal respiratory rhythm set by your brainstem. Breathing is one autonomic response that you can control, unlike your heart rate. And this is possible because the nerves supplying your muscles of breathing are present in your motor cortex. They can simply override your brainstem signals, allowing you to hold your breath, such as when you're underwater. However, overriding emotional control of breathing requires habituation, i.e. a dampening response to repeated exposure to the same stimulus. Okay, now you should have a good idea of how we breathe. Now let's move on to how we can measure it. There are two main ways of measuring lung function. Peak flow is a way of measuring forced expiratory volume, which is defined as the maximum volume of breath forcefully expired in 1 second after maximum inhalation. If you're an asthmatic watching this video, then this image should be very familiar to you. Another more robust method is a spirometer, which literally means breath measuring from Latin. This can be used to measure both FEV1 and also another parameter called forced vital capacity, which is defined as the total volume of breath forcefully expired after maximum inhalation. Additionally, this can measure your tidal volume, which is the volume of air breathed in and out during a normal respiratory cycle. When using a spirometer, you can obtain different types of diagrams depending on how you ask the person to breathe. This is one type. Notice that the forced vital capacity essentially measures your lungs' vital capacity. But let's move on to an important volume that you do need to remember. That is residual volume. And what is it? So this is the volume of air not involved in ventilation. This prevents the alveoli from collapsing and making breathing easy. It's easier to blow a balloon with some air already in it than a balloon without. And it's important to remember the names of the different volumes, but the inspiratory and expiratory reserve volume is not needed for A-level. These are the three common lung pathologies often asked at A-level. Let's start by looking at asthma's pathophysiology. And pathophysiology simply means how the disease causes symptoms. The bronchioles in the lungs contain smooth muscle, which are under autonomic control. In asthmatics, an allergen such as dust can trigger an excessive immune response, which causes contraction of the smooth muscle and also excess mucus production. This narrows the bronchioles, meaning less air enters in each breath, so hence FEV1 decreases. But FVC remains normal as the lungs are not damaged, so the lung still retains normal capacity. Hence, the FEV1 to FVC ratio decreases. This is an important ratio to determine the type of lung disease individuals may have. Emphysema is a type of chronic obstructive pulmonary disease, COPD for short. This is a progressive, irreversible condition where the alveolar walls are broken, reducing the surface area of the lungs. In emphysema, both FEV1 and FVC decreases, but FEV1 decreases more significantly. Hence, the FEV1 to FVC ratio you obtain for emphysema is similar to asthmatics. So how can you differentiate between asthma and emphysema? Well, since asthmatics respond to inhalers, their FEV1 improves, while in COPD this generally doesn't happen. But there is a caveat to this which you do not need to know for A-level. Finally, let's look at lung fibrosis. This is where damage to the lungs causes scar tissue to form. And this is similar to the scab that forms on your skin when you injure yourself. Like the scab, the scar tissue is not very elastic, so the lung cannot hold as much volume as it did normally. In fibrosis, the FVC decreases more significantly than FEV1, meaning the FEV1 to FVC ratio increases and is often greater than a normal individual. And these are a few scenarios where getting a high percentage score is not necessarily good. So this is another diagram the spirometer can produce, which can measure both FEV1 and FVC. As you can see, in obstructive diseases such as asthma and COPD, the FVC is relatively close to the normal line, whereas in fibrosis, the FVC is significantly lower than the normal. But since FVC is significantly lower than normal, the FEV1 to FVC ratio you obtain in fibrosis is generally higher than normal, whereas in asthma and COPD, this is much lower than normal. Phew, a lot of content covered there. Do take your time in understanding this complex knowledge. As usual, use these objectives as questions to consolidate your learning. I thank you for watching, and I'll see you in the next one.